Do what you can do. At the very least, maybe you floss and brush at night. And then if you have a hard time with some of these things, this is where diet comes in. You need to double down on your diet. I do recommend that. And move your body and hang out with amazing people and have a beautiful community. And it's so much to simplify, it's inflammation. You want to keep your inflammation as low as possible.
So you've spoken about how dental care connects to everything from fertility to dementia risk. Can you unpack one or two of the most surprising systemic connections that dentists and us, the general public, often miss?
This is an excellent question, and so many people do not realize how important their oral health is in the state of their mouth and how it can impact different organ systems. So what tends to garner the most response and attention from people is when I speak about the Alzheimer's and dementia risk that can be associated with bad bacteria in the mouth, pathogenic bacteria, specifically a bacteria called P. gingivalis, which is found in periodontal disease. Periodontal disease is gum disease that's become more chronic, and you start to lose bone around your teeth. So brain health certainly is profoundly important. Certainly to me, and that it does tend to motivate people. And then I would say fertility as well. You know, there are these couples out there really sometimes struggling to conceive, and no one is talking to them about their oral health, their gum health. Do they have outstanding cavities that need to be treated? Do they have failing treatment, infections in their mouth, etc.? So this all comes back to the oral microbiome. We all know about the gut microbiome. The gut microbiome's been front and center for almost 15 years now. And we talk about intestinal permeability and all the downstream effects that can have on the body. I want everyone to start thinking now about, instead of leaky gut, leaky gums, and how bacteria in the mouth can get into the system and wreak havoc on other organ systems as well.
So let's focus on cognitive health, because I think that's so top of mind for everyone right now. And P. gingivalis, how does that show up? What are the symptoms? Are there tests I can do? Can I ask my dentist, like, hey, do I have this? What's going on here? How do I assess my state?
Yes, great question. So I think at first it's important to just help people understand, well, how does oral bacteria impact my brain? Okay, so we mentioned leaky gums. So the bacteria can physically get into the circulatory system and end up in places they shouldn't. They can cross the blood-brain barrier and end up in the brain tissue, where they cause an inflammatory response, an inflammatory cascade, essentially cytokine release, and they release endotoxins, exotoxins, and create neural inflammation. Okay, and there have been studies that have shown that patients who have passed from Alzheimer's, when tested, have a really high level of P. gingivalis in the brain compared to controls who did not have periodontal disease, who really have no P. gingivalis in the brain. So this is an important thing to discuss. But how would you know? Because obviously this is happening decades before we might see cognitive decline. And this all comes back to oral microbiome testing or salivary analysis. So this is spit testing. And there are many tests out there now. More progressive functional dentists will be doing this in their offices, but there are direct-to-consumer brands now, so that you can really take your health into your own hands, and you send it off, and 2 weeks later you get your results, and it will show you, where you are with these certain pathogens. And it's not just P. gingivalis. There's other really virulent bad guys too, if you will. F. nucleatum, for example, is linked to pancreatic cancer and colon cancer. And there are very specific bacteria linked to specific things in the body. And these companies now have it so dialed. The interface is so user-friendly. And then many of them now are starting to create protocols for patients so that if they do see a high level, it will tell you how to eradicate them.
How accurate do you think they are?
The testing or the protocols? The testing, I think it's pretty accurate. I do find it to be pretty accurate. There's different types of testing. So the one I really love is called shotgun metagenomics. And a lot of the newer companies coming out are using those. So you can see it clinically that when you test a patient, they do tend to come in not looking clinically healthy, and then you put them on a protocol, and then the tissues do firm up and get pinker. They say they experience less halitosis. maybe less tonsil stones. They're now not experiencing cavities to the rate they did. Again, their tongue coating goes away. So you do see the shifts clinically too.
So is shotgun metagenomics the method or is that the brand of test?
That's the method. The method that there are different tests popping up on the market. We can put some in show notes. I can mention some now.
Mention some, please. Yeah.
Yes, I will mention bristle, like a toothbrush bristle is direct to consumer. It's one I really love. It picks up everything and not only the bacteria, but it will pick up fungus, viruses, protozoa. And it also is assessing how they're interacting with each other and what toxins they're releasing. It will look at some gut species too, because it's important to know the mouth is the gut. Okay. We need to start thinking of it that way. It's the entryway into our body. And if you have gut health issues and you're working with a naturopath or a functional medicine provider and on these protocols, but no one's looking at your mouth and talking about oral microbiome protocols, it's very likely you're never going to achieve true health. They are connected, bidirectional. So bristle is one I really love. Candida is a big problem in a lot of people with oral health issues. So I just want to point that out. And bristle will pick up candida. And then Viome is another. Oralis is a new one out of the UK. I think we are just at the forefront of this salivary analysis testing. It's starting to really blow up and people are taking more and more interest in the oral microbiome, which is exciting.
It's interesting because the rub on some of the stool tests for the gut microbiome is, they're kind of, it depends on the day. They're not as accurate as you think. Directionally, they can be helpful, but it's not quite there yet. So it sounds like the oral ones are a little bit further along.
Yeah, I do. I agree with that to some extent, though, as well with oral microbiome testing. It's a moment in time, right? So it does change. I mean, anytime you put anything into your mouth, your oral microbiome will shift. And think about children. That's why oral microbiome testing kids is hard because they're constantly putting things in their mouth, and then it has to go back to the terrain theory. So if you put a negative bacteria, bad bacteria into your mouth, is your body capable of adjusting and acclimating to that, or will it eventually take over? And so that's the host response.
And it sounds like you're probably okay unless you're having some of those symptoms you mentioned, like maybe it's bad halitosis, maybe you're too many cavities, like your mouth is inflamed. Like, can you walk us through some of the symptoms? Because I also don't want to freak everyone out. Where it's like, oh my god, I need to take this test to make sure. But like, walk us through some of how this may show up.
Yeah, so certainly cavity. So let's say you're doing everything right. You feel like your hygiene is excellent, your diet's pretty darn good. Maybe you're not mouth breathing, you're breathing properly because mouth breathing can lead to dental disease. But every time you go in, you have new cavities. I suggest you oral microbiome test because it could be fungal. Okay. Or it could be this species of bacteria that just brushing and flossing isn't going to eradicate. Sometimes we need pharmaceuticals for some of these bugs or certain strains of herbs and nutraceuticals, like very targeted approaches. Gum disease, so puffy bleeding gums, we say pink in the sink. This is not normal. Common is not normal. So if you have gum inflammation or gum pain, and if you go into the dentist, perhaps your hygienist has probed you. So there's like 3, 4, 2, 3. What are they're doing? They're measuring attachment levels. So essentially, how healthy are your gums and your bone levels? And if you find every time you go in, those numbers get bigger and bigger, they go from 3 to 4 to 5, you're losing attachment, you're losing bone. So that's called periodontal disease. And so that's a reason. Halitosis, I think so many people have normalized bad breath and they reach for the Listerine bottle. We can get into my issues with that, but it's masking something your body's telling you. Your body is telling you you're in a state of dysbiosis, you're in a state of infection or imbalance. So we need to listen to these signs and symptoms. And tonsil stones, patients who get chronic tonsil stones, white coating on the tongue usually can be fungal or candida related, coming from the gut too, but we have to treat the mouth as well.
And so for bone loss specifically, it doesn't have to be a reality as you age. Because I think there was a prevailing, I think many, maybe this is an overstatement, but I think there are many traditional dentists who would say, oh, you're just getting older. And this is what happens. Doesn't have to be that way. Can you talk, what are the things we should be doing proactively so we don't find ourselves in a dentist chair and dentist is saying, well, losing your bone, not much to do. It's just getting old.
I mean, think of physicians. They do the same thing. They're like, oh, you have osteoporosis. No big deal, just part of aging, or aches and pains, or arthritis, etc. So thank goodness we're learning more about that. You do lose a little bit of bone as we age. Like, that can be a reality, but it should still be within normal range, right? So what can you do? To me, it all comes down to diet foundationally. It's our nutritional status. And so many people do not think of this when they think of oral health. But if we are collagen and protein optimized, if we are optimized for micronutrients and fat soluble vitamins and magnesium and creatine and all these things we speak about for optimization and longevity, these all impact oral health too. So a whole food diet, a wide range of food, eat the rainbow foods, fermented foods to support your microbiome of your gut and your mouth, hydration, electrolytes, all those things are very, very important. They support bone health, dental development, and salivary health. And I want people to start taking their spit very seriously. Your spit is important. It's the golden elixir of your body. If we didn't have spit, we couldn't chew, we couldn't swallow, we couldn't speak, we couldn't digest, and you would have rampant decay and rampant gum disease. So please please respect your spit. So certainly start with nutrition and hydration. I would then move actually into how we are breathing. And you and I have spoken about airway health before, but how you breathe is profoundly important to your oral health. And so if you are a mouth breather, or even if your mouth is open for a large portion of the day or at night, you're changing the microbiome of your mouth and you're changing the pH of your mouth. So when your mouth is open, your saliva tends to dry out. So all that goodness I just mentioned no longer is there to be beneficial. And the pH change, it becomes more acidic. Pathogenic bacteria love acid. They don't like a neutral environment. They don't like an alkaline environment. They want acidity. So mouth breathing can lead to gum disease. It can lead to cavities, tonsil stones, halitosis, all of these things too. So getting your airway health under control is quite important. And then finally, I would say hygiene. So this is lower on the list. And I think traditional dentistry has always said hygiene trumps everything. I disagree. Hygiene's pretty low on the list. And to me, I can't overemphasize the importance of flossing or water picking, getting the bacteria out from between your teeth. That's what you are doing. Most people think it's about removing food. It is about disrupting the biofilm. So what's really cool about the mouth is we can actually access the biofilm in our mouth. We can't access our sinus biofilm or our gut biofilm, but you can in the mouth. And that's what plaque is. And so you're disrupting the biofilm so that if there are bad bacteria clinging to your teeth, they are releasing acid, and hopefully they're not sitting there long enough for that acid to pull minerals out of your teeth or irritate your gums to the point where you now have disease like cavities or gum disease. So, flossing, water picking, brushing, tongue scraping are all some of my favorite things from a hygiene standpoint. But again, I really want to always go back to nutrition. Are you eating ultra-processed foods? Are you snacking and sipping all day on crackers and chips and granola bars and frappuccinos? Or are you eating on a schedule? Timed eating is very important for oral health too. And this is because every time we put something into our mouth, our oral microbiome shifts and the pH shifts. So it is part of the digestive process to have amylase enzymes to come out, break down food. The pH drops to an acidic level to help break down food. And that's part of the digestive process. But what we do in modern society, we never give our mouth a rest and allow saliva to neutralize again. We're eating too much. So eating on a schedule is really important too.
Another reason not to pick and snack during the day.
Just eat high protein meals and try to be satiated to get yourself through the next eating exposure.
So, in terms of products, what's your go-to? Walk us through the morning and evening in terms of, what do you do in terms of brushing, the toothpaste, oil pulling? Like, there's so much out. Like, walk us through your routine or product stock, if you will, on what people should look for.
Yeah. I find with my interactions online with people that people do want an exact protocol, but they also are overcomplicating things. Less is more to me. But I will tell you what I do, and I am not by any means neurotic about any of this except the flossing and brushing part. So let me explain. So I will oil pull. I use raw organic coconut oil, and I'll do it a couple of times a week. I do it in the morning. And so oil pulling is an ancient Ayurvedic practice where you swish some oil around the mouth. You'll hear people say you need to do it for 20 minutes. I disagree. I find benefit just after I do it for a few minutes. It feels good. It makes my teeth feel smooth. It's dislodging the biofilm. Coconut oil has lauric acid in it, which has a whitening effect, and it will disrupt the microbiome. I don't do it every day from a time standpoint, but also because it has that lauric acid in it. That is an antimicrobial, although it's mild. I don't want too many things in the mouth that are damaging not only bad bacteria, but good bacteria too. And so traditional products in dentistry, you see kills 99.9% of germs. We need to shift away from that mindset. We don't want to kill all of our bacteria and all of our germs. I think we're slowly all collectively learning this, that we are microbes and we need to respect and cherish them. So I will oil pull a few days a week. I then also like to tongue scrape, another ancient Ayurvedic practice. You can use a stainless steel scraper or copper, generally is what's recommended. You are just removing the biofilm from your tongue. I also do that in the morning. This can actually help with cardiovascular health as well. And this is because the bacteria responsible for the nitrate reducing process, which ultimately results in nitric oxide production, they like to live down deep in the crypts of your tongue. But pathogenic bacteria and candida and such live on the dorsum, the surface. So you're just kind of scraping off that pathogenic biofilm as well as food particles, and then preserving the healthier bacteria to do their job down in the crypt. So tongue scraping is one of those things, don't knock it till you try it. And everyone I've ever spoken to who starts doing it, they become hooked on it.
So when do you do it? When is it, like, right when you wake up if you do it in the morning, or before brushing teeth? What's your process? Like, how does it fit in the routine?
I'll do it before I brush my teeth. I'll clean my tongue first.
Every day.
Every day. Yeah, I do. I do it every day. You'll find it makes your food taste better too. You don't realize how many molecular particles of your food are left on your tongue. And so it's kind of, it's truly palate cleansing as well. So just observe that if you start doing it. So I will tongue scrape in the morning. I floss in the morning also. I don't expect everyone to do this, but I am in the dental world. So I'm very hyper focused on my hygiene, but I floss in the morning and then I brush. Okay. I do mostly that same routine at night, except I don't oil pull at night. I will tongue scrape, floss, and brush. Now I'm in my 40s, and as we age, we do lose a little bit of bone around our teeth, as I mentioned. And so I like older adults, as we are, not too old, but middle old, to floss and water pick. Okay, so water picking, it's just doing it. It's cleaning in a different way, cleaning down in the sulcus and flushing the bacteria out that way. So I tend to alternate floss one night, the next night water pick. Floss one night, the next night water pick. I don't keep track of this. I just, as best I can in my mind, kind of alternate it.
Is there a favorite water pick machine you like?
It's the brand Waterpick, and it's cordless, and it's very svelte and beautifully designed, and it's easy to hold, but you can bring it in the shower. Some people get like suction cup mirrors or have mirrors in their shower. Kids can do it in the bathtub. It's really great for kids that have oral sensory issues, that just hate flossing. It's great for people with big hands. Flossing is hard. to do for certain sized people. And so water picks can be a good alternative too.
So if we start with the basics, I'm brushing my teeth and I'm flossing. What should I look for in terms of reading a label and specific brands?
Yeah. Floss is a dirty world, I'll tell you that. So be careful of your floss. I've seen this make the rounds on social media, so perhaps your listeners are already aware, but there are a lot of microplastics and PFAS and just nasty chemicals in floss. So my favorite types of floss are silk or bamboo, ideally not impregnated with fluoride or, fake natural flavors and just other additives and chemicals. I think the simpler, the better. Now, some people really struggle because maybe they have crowded teeth or they have fillings or crowns that aren't ideally shaped. And so their floss shreds. Obviously, I don't want to be a purist. So if you need certain types of floss for certain areas of your mouth, I'd rather that you're flossing than worrying about, whether your glide floss, has PFAS in it. But I would steer clear of some of these brands that we know are heavier in the chemicals, and maybe you should become a water picker, water flosser. So silk or bamboo floss is the cleanest. It's also better for the environment too. So that's from a floss standpoint. Toothpaste, there is a mindset shift that I believe needs to happen, much like how we have moved away from foaming shampoos and washing our hair every day, and maybe we've shifted away from traditional deodorant with aluminum and all these other additives. And there's always a transition period, whether you're shifting your toothpaste or your shampoo or you're shifting your deodorant. It's the same with your toothpaste. So many people are used to that burning, foaming, tingling sensation when they brush their teeth. And I want people to think about what that might actually be doing. What are those chemicals that are causing that foaming and that tingling and burning doing to your microbiome? So the foaming agent in specifically is called sodium lauryl sulfate. It's actually a type derivative that was used in floor cleaners. So that doesn't sound great. But that foaming, it's stripping away healthy tissue, and it can be damaging your oral microbiome. So you want to look for SLS-free toothpaste. Be cautious with really strong essential oils. I know we love essential oils generally, but they are potent. They are antimicrobial, and they work really well. Some as strong based on the data as antibiotics. And so they're not selective. So they're not just killing bad bacteria. They can be killing good bacteria too. So just be cautious with putting strong essential oils in your mouth every day. Triclosan is another ingredient we want to be avoiding. Thank goodness that's starting to phase itself out. It's less is more. I want people to look at their toothpaste just like they look at their food labels. Okay.
What are some of your favorite brands?
Yeah. So we can speak of fluoride, too, a little bit right here. So
You're going right for it. Let's go into fluoride.
I'm going to go for it. I think we have to because that's an ingredient. Okay. So there is systemic fluoride and then there's topical fluoride. Let's just talk topical because that's what we're on right now. So fluoride, when incorporated into oral healthcare products, has been shown to make your teeth more acid resistant. So as I mentioned, that biofilm, those bacteria, if they stick and cling to your teeth for too long, they release acid. That acid pulls minerals out of your teeth. So fluoride makes your enamel more resistant to that acid attack. So it's less likely to suffer mineral loss. It might take it a little bit longer. It is not a cure-all. It is not a guarantee. Plenty of people on this planet get cavities if they use topical fluoride. It's why cavities are still the top chronic disease globally in both children and adults, even in populations using fluoride toothpaste. Okay, so I just want to point that out. And this is all because it comes back to diet. So what are these people eating? And how frequently? Okay, and what are their hygiene practices, of course. So I do want people ideally using an active ingredient, an active remineralizer, or something that's going to be protecting their teeth. And so that would be fluoride if you're interested in that. I personally avoid fluoride because it is considered a neurotoxin, generally more if it's consumed systemically and at certain dosing. But I just steer clear of it. Less toxins, better for me. But more importantly, and very few people speak of this, fluoride is antimicrobial. And so it's not selective. And so what is it doing to your healthy bacteria? This is what I am worried about.
So let's pause there because I think that's a very important point. Because the quote unquote dental establishment will push hard, very hard on the fluoride as a neurotoxin because the levels have to be substantial, like way more than you would get from brushing your teeth every day to cause damage. But I think, so I'll just pause there. But I think you're hitting the point as it relates to toothpaste. Like I'm not going to get in the fluoride water convert because if you're drinking fluoride water, that's a whole nother thing.
Well, that's a whole other podcast.
The whole other podcast. I live in Florida. I think they got rid of fluoride here. So, but the more important, if you believe that the microbiome is critical to your well-being, then this is very relevant and real. It's hard to argue if fluoride is impacting the oral microbiome. You want a healthy oral microbiome, like you don't need to say more.
Right. Yeah. I mean, it is the argument with water fluoridation too. If you take out all the neurotoxicity conversation, you are swallowing fluoridated water that is antimicrobial. What is it doing to your gut microbiome? And there is ample data to show that it impacts commensal bacteria and affects diversity. So anywho, but we can go back to top. Well, the other thing I will say, I agree that you would need a lot of fluoride toothpaste, but fluoride is cumulative. We don't excrete it 100%. It does accumulate in calcifying tissues. It can, it impacts thyroid health. Dental fluorosis affects now 20% of teenagers. Newer studies and data.
What's that? What's dental fluorosis?
Dental fluorosis is a sign of too much fluoride. It's when you get white spotting and mottling in your teeth. That also means you're going to have that in your bone. There's skeletal fluorosis.
So that's 20% of teens have that?
40%.
40. Wow.
Newer data is saying up to 60. So we're getting too much fluoride. So my only point, and we could talk about this for hours and debate it. If you are really wanting fluoride in your life, I'd caution you not to use it in your children until they spit. Make sure your kids are spitting.
Jason Walkup here, founder and co-CEO of mindbodygreen and the host of the mindbodygreen podcast. Please subscribe. You'll never miss a show and you won't regret it. Well, I'll just pause there because from what I'm hearing as a parent who has 2 young children, we pass on the fluoride with the dentist. And I'm trying to think of what's a great reason to demand fluoride.
I think in certain patient populations, it can be beneficial because they aren't implementing all these other lifestyle protocols that perhaps you and I are. So they need the extra boost, but I will tell you these patient populations are still experiencing rampant decay, and it's all because of their diet. Fluoride toothpaste is no match to an ultra-processed food diet. It cannot compete. So we are missing the mark, in my opinion. I agree with you. I mean, my kids have never used fluoride in their lives. So
in terms of, okay, we're shopping for a toothpaste. This is where this started. We've avoided the fluoride aisle. What should we look for? And I can never pronounce it. It's hydroxyapatite.
So think hungry. I'm hungry, hydroxyapatite. So I do love hydroxyapatite. I have been using it in my practice since about 2015. I'm a huge fan of it. When my patients start using hydroxyapatite, particularly, I prefer nano hydroxyapatite. There's also micro. I see such a shift. I see a shift in their microbiome because hydroxyapatite has now been shown to actually shift the microbiome. It can make commensal bacteria communicate differently. It can change the biofilm. So it's not just remineralizing. It can be beneficial to the microbiome. I see patients get healthier. Their teeth get stronger. Their salivary health is better. And I believe it's because they were using a fluoride toothpaste and their microbiome was being impacted by that antimicrobial effect. And a lot of patients will say, I got off my fluoride toothpaste and my oral health improved. Now, you also hear the opposite. I went off my fluoride toothpaste, I switched, and I got decay. Now, my argument to that is what I want to know exactly what you're eating. And I want to know how you're eating it and how you're breathing. But anyway, hydroxyapatite is what is in your enamel already and in your bone. So 94% of your enamel is comprised of hydroxyapatite crystals. It's essentially minerals, calcium and phosphorus. 65% of your bone. Okay, so this is in our bodies already. It's already circulating around in our body as well. We have hydroxyapatite. And so the data has shown, and in fact, we just had a comparative study come out that I worked on with some colleagues that shows nanohydroxyapatite works as well as fluoride toothpaste. And in certain concentrations, it can compete with a prescription level fluoride toothpaste. So this is what my family uses. This is what I recommend to patients. Another active ingredient you could look into is something called theobromine, which is a derivative from cacao. And the results are very great of what it can do for remineralization as well. And there's some brands out there using theobromine. So
What toothpaste brands do you like?
yeah, so full disclosure, I have my own oral healthcare line called FIG, Feed Your Good Guys. I created this because I loved Boca, which is in existence still. That's what I was originally using. I still recommend Boca, but Boca does use essential oils, and I'm concerned with what that's doing to the microbiome. But then we wanted to add microbial boosting agents to it, so prebiotics and amino acids. And so my co-founders and the formulators that we worked with, we are an oral microbiome supportive brand with hydroxyapatite. I also love Boca. I think that's a great product. Knobs is another great product out there using hydroxyapatite that are little tabs if you are into tabs. And then Theodent is the theobromine derivative toothpaste out there. So there's many great brands, and just like anything, like one supplement might work better for you than another brand supplement, and one toothpaste might resonate with you more than others. So it's really nice that there are more and more options coming out on the market.
Well, I love Fig, FYGG.
Thank you.
So my only question, when are you going to come out with mints?
They're already out
How come I don't know about this?
because it's a soft launch, except now it's not.
Okay, we'll have to talk about that offline.
Yeah, we'll talk about it offline. I'll send you some.
It was a soft launch. I will gladly take some. So you also mentioned Listerine.
Yeah.
It's not good.
Yeah. So Listerine is antiseptic.
We'll call it, we'll take a step back, mouthwash in general, because Listerine is technically a brand. We don't want to,
No cease and desist.
mouthwash more generally.
Fair. So I would say any mouthwash with strong antiseptics or alcohol based are a no-no, and they usually tend to be bright blue or bright green. We'll just say it that way. And they burn, right? And this is something people will use a lot because they suffer from chronic halitosis. And my argument is, well, your chronic halitosis is your body telling you you have metabolic disease and maybe even mitochondrial dysfunction. I mean, we can get into all of actually what's happening in the mouth, but imbalances in the microbiome, to say the least. So why are these mouthwashes concerning? Because they're wiping out healthy bacteria. Specifically, the studies are showing that healthy bacteria I mentioned that live down in the crypts of the tongue that are contributing to nitric oxide production. Nitric oxide production is a molecule that helps with immune health, but also cardiovascular health. And so patients using daily mouthwashes that are strong like this have been shown to have high blood pressure, cardiovascular issues, and there's even preliminary pilots showing that maybe it can contribute to stroke and cancer in the mouth also, like oral pharyngeal cancer. So these are not good things. If one must use mouthwash, I suggest trying to use a cleaner, more essential oil-based mouthwash. Although, like I said earlier, I don't love essential oils in the mouth every day. Or even better, low cost, no cost is just water with a sprinkle of baking soda and salt.
Yeah, old school.
So old school. And it will neutralize the mouth. It buffers the mouth. It protects the bacteria. It's, the salt is antiseptic. So I will occasionally do that as well. And I'll put baking soda and salt in my water pick sometimes and rinse around with that. That's what I do.
And what do you recommend for, as I, sip on my black coffee, which I love and have black coffee for probably 30 years, and I just can't get enough of it. Unfortunately, it doesn't bode well for having shiny, bright, white teeth. What do you recommend for those of us who are looking to have our teeth just be a little bit whiter?
I got you. I'm a black coffee drinker too, so I totally get it. Well, an electric toothbrush can help. Well, first of all, after you drink your coffee, try to sip some water. That's a nice thing to do right then.
I can do that.
Yeah, or like drink your coffee, have a sip of water. Drink your coffee, a sip of water. That can help. So you're just not allowing the stain to sit there too long, or the coffee to sit against your teeth for too long. An electric toothbrush can help. You can make a slurry of baking soda with water and use that to help brighten and whiten. Nanohydroxyapatite has white papers and studies to show it actually has a brightening effect. It's because it fills in the microporosities on the surface of your teeth. So the way the light reflects and refracts, it looks smoother and brighter. So it can have a brightening effect. You'll see a lot of people, especially this goes crazy on TikTok, they use hydrogen peroxide. I caution you all not to use this too much because it can be damaging to the mucosa and the microbiome. But a little diluted hydrogen peroxide here and there can be a nice at-home tool. People can go in more frequently for cleanings. A lot of times that stain polishes right off. It's extrinsic. It's on the outside of the teeth, so it polishes off very quickly.
So a cleaning. So you'd be okay with going to your dental office and say like, hey, can you clean this?
Yeah, you say, can you just polish me today? Like, I just want to polish.
Okay. What about all like the teeth whitening products available on the market?
There are some better brands, like Luminu is a really excellent brand. They have, cleaner white strips, if you will, made with more herbs and essential oils. You're just not going to get the Hollywood bright white effect. But if that's what you want to achieve, I support people in what they need and want to feel good. And you can go in for traditional bleaching, but just please don't overdo it, because every time you bleach, you could be damaging the nerve of your teeth. You're causing sensitivity, and it's changing the microbiome too. So, unfortunately, we are inundated with filtered photos and veneers, and some of these aesthetic standards are just not realistic. Like, you're not going to achieve it at home with any product. Like, you are going to have to filter every photo you put out into the world, or go get veneers or something, or really, really high octane bleach. And, when you interview these patients who have done these procedures, most of them have terrible sensitivity or even start needing root canals because they just trashed their nerve system.
So you're leading me to a couple questions. And one of them, and I definitely want to talk about root canals because I've had experience there. This idea, look, beauty and wellness are merging, and everyone wants to achieve health span, do all the things they want to do for as long as possible, but they also want to look good. And we've come so far with all the sorts of bells and whistles, the non-invasive cosmetic procedures and invasive cosmetic procedures, and all the peptides and the drips and so forth. And I think about dentistry. How do you think about that tension between, function and cosmetics as we think about the mouth? What are the hacks of the future? Because I don't want to, I'm wearing my Whoop. I've got my VO2 Max dialed in, and I'm all set to live till 90, but I don't want my mouth to fall apart.
I'm so jealous of your heart rate variability, by the way. I watch that online every day. I'm like, Jason, oh, okay. Like, he's up 10 more points. How did he do that? Okay. The first way to start is prevention. This won't help most of us, but if you have children, it does. So if you can get their jaws growing optimally, a lot of the things we don't like about our teeth is crowding and rotation and small, narrow jaws. So if we can get big, wide, expanded jaws, which helps airway health, the aesthetics follow. If you look at ancestral skulls, there's one right there over me. The teeth are really straight. They're very aesthetic. They're beautiful. The jaws are nice and wide. So you want to start early with airway intervention. For those of us that maybe missed that opportunity, you could consider Invisalign or just some sort of orthodontics that's minor, but maybe just rotates your teeth in some degrees that you prefer the aesthetics. Because a lot of times the way the light is hitting is because the tooth is tilted or rotated. If you straightened it, you would like the way it appears more. From a whitening standpoint, you have to decide how important this is to you. Do you want to avoid all these foods? You want to avoid berries and wine and coffee? I mean, I might suggest avoiding the wine, but chocolate, these things stain, but we need to live life. And so you could go in once a year if you wanted for bleaching at your dental office. There are opalescence is a bleach that you can get on Amazon, but you need a custom tray made, so your dentist could do that for you, and that works quite well. And then if you really want the really bright white teeth, you could look into veneers, but please think about no prep veneers. Those are the ones you don't remove any healthy tooth structure. I like all patients to have informed consent, and like you must be going over risks and benefits. So just remember, anytime you put something in the mouth, it will shift your microbiome. And that includes these veneers. So you're creating surfaces. I don't care what the dentist says. There's going to be a margin where that veneer is stuck to that tooth that bacteria can now cling to. I mean, this is when you can start over time and years and decades getting bad breath too. So just know what the risks are.
We'll talk about veneers and root canals and implants. So I had a root canal essentially go bad. And it was 10 or so years in. And then I said to my, very traditional dentist back in New York a couple of years ago, I'm thinking maybe we should, take a look at this. And I was surprised. He said, yeah, I think you're right. I think you should take it out. And I think we should extract it and put an implant. You're healthy. You don't want to do it later in life when maybe you've got like some issues. Like, let's do it. And I was surprised because it was a very quick yes. And I wasn't expecting that. And so I had it done. It was a 6-month process. I also had like a veneer next to it because it was the 2 front teeth. He's like, I recommend it'll be better, like more stable and like aesthetically everything. And I said, okay. So I'm researching this, and a couple things. One, if you go to social media, there's a lot of noise out there that essentially makes you think if you have a root canal, like you're going to die. I'm speaking hyperbolically, but it's a lot of fear mongering. And then so I'm curious, I'm open. I said to myself, okay, like, what's going to show up in my labs after I get this thing done? There's something going to miraculously improve or get back in line that maybe wasn't. Nothing happened. The other thing, when I was asking around, a lot of people will preach the benefits of ceramic instead of titanium. And when I went to the procedure, the doctor the surgeon who did the procedure was very open to it, but he's like, look, like your hole isn't gonna, the opening you have won't allow for that. And I'm worried like you're gonna crack this thing. I'm like, okay, I don't need to hear more. Like the last thing I want to do is go through a 6-month procedure and then 5 years I'm, eating shellfish or something, whatever, and it cracks. And so let's talk about that. Cause I do think there is some fear mongering here that you've got this thing, and like, look, there are some principles like, okay, you got this dead thing that you probably don't want, but is it really killing you? So I'll pause there. And I think this is where I love how pragmatic and balanced you are.
Oh, thank you. Yeah. Whew, lots to unpack there. Okay. So let me share my story too. I also had root canal teeth. I suffered a pretty gnarly bicycle accident when I was 10. I knocked teeth out. I fractured teeth. I just had mine taken out 4 months ago or 5 months ago. I also noticed zero differences in my labs. And I'm like you, I am high data person. I like a lot of data and I test myself a lot. I didn't notice any difference. So, I mean, that's good, I guess. And I'll tell you why that's actually maybe good. So I agree with you that there's too much fear on social media, not just in dentistry. I mean, every industry. People are chasing the algorithm. They're trying to get your attention. They want you to stop scrolling. Okay. So it has to be sensational. I think that when you really, really accept that and understand that, you can be more balanced in how you take in this information too. So the other thing we need to know is we are all different. Nothing in medicine or healthcare or dentistry is black and white. So a ceramic implant might be better for one patient and you might be fine with a titanium implant. It's all different. So anyone that says this is the way it has to be, flat, period, no change, this goes for products too. Like my product is the only product that works. All these other products are awful. That is a red flag. You guys need to just swipe on by. Okay, so let's start, I guess, with root canals. So the problem with root canals, there's so much fear around it. We're fearing the wrong thing. A root canal is a part of your anatomy. Each tooth you have has a root canal system. So we are fearing the wrong thing. You can't be afraid of a root canal. That's the nerves and the vascular system and the nutrients and the lymphatic system that comes up into your teeth. What people are worried about is the procedure and the techniques and the materials. Okay. So, unfortunately, I do believe a lot of root canals are not done optimally. They're rushed, the materials aren't great. People are going to a dentist without a lot of experience doing root canals. If you need a root canal, you want to go to a dentist, ideally that's an endodontist, someone that does root canals, all root canal procedures all day, every day. That's what they do. That's my best recommendation for you. Someone that's using a microscope and that they're using cleaner materials, biomimetic materials, if you can find someone. Maybe they're using lasers, ozone. Okay, this all matters. And so if you are able to achieve that, you can have a very successful root canal, and it may get you through decades and decades and decades like it did for you and I. The thing to know is nothing in dentistry is forever. Nothing. A filling, a veneer, a crown, a root canal, it's never going to last forever, most likely. It depends how old you are, right? If you have a filling and you're 107, maybe it will last the rest of your life. You get my point. But your root canal probably is going to fail at some point of your life, but how important is that tooth for you to keep for that long, So that was why I kept mine. So the other part that's missing from this conversation is, again, terrain theory. What is the human like that's hosting and keeping this root canal in their body? Are they healthy? You and I are probably generally considered very, very healthy people. That's probably why we didn't notice any difference in our labs, because it just wasn't affecting us. But if you have autoimmune disease, if you are a sick person, if you have certain genetic polymorphisms, then maybe a root canal is contraindicated. And so it gets very nuanced. And this is where functional dentistry comes in. Instead of everyone just getting everything, you work the patient up as an individual. You might test them. You might see if they have certain sensitivities to materials. You might run some genetic testing. You might run some micronutrient testing. You want to know the state of health of the whole system before you go altering it. So that I think root canals can be an amazing, amazing procedure. And I think they're not right for some people too. And I just think it's really bio-individual.
Yeah, a lot of nuance.
Yeah, tons of nuance. But I will say this, if you have a root canal, I would like you to consider getting 3D imaging of it every 3 to 5 years. So the normal x-ray you get at a dental office, you cannot see if it really is failing. It misses so much. You really need a CBCT, and a lot of low-grade chronic infection is missing. And the other thing I'll say is, if you are experiencing these symptoms that you cannot get to the root cause of, weird rashes, headaches, etc. There are some that will link failing root canals back to different cancers and things. And you need to look toward your mouth. Like, we need to look at everything in the mouth and every tooth and the gums and the fillings and the root canals and see if your issue's coming from the mouth. And this is where, people cherry pick their cases. So they have someone coming in that's really sick and they take out their infected root canals and the patient gets better. Well, that's wonderful, but that doesn't mean that is going to be the case for everyone, especially if you're living life well and healthy and thriving, then your root canals in your mouth are probably just fine.
Right. Unless if you're experiencing symptoms, take a look immediately. If you're not, check in on it periodically, but you don't have to freak out and run to get a procedure done.
That's right. Yes. I mean, chronic infection is usually asymptomatic, which is why you do want to check them periodically.
So you mentioned functional dentistry. Let's talk about your institute. Very exciting.
Thank you. Yes. So I went through the Institute for Functional Medicine certification program a few years back. There aren't many dentists out there that have done this. I believe there's only 5 of us in the world. It was so eye-opening to me, all the connection, the hormone connection, the immune health connection, the cardiometabolic, all of it. It all needs to be tied together. But they don't cover a lot of oral health or dentistry for obvious reasons, because this is mostly physicians, although they do a pretty decent job to educate physicians on the connections. So I became friends with some of the other dentists who went through the program, and we are allied partners with the Institute for Functional Medicine, and we are launching the Institute for Functional Dentistry. So one of the most common questions I receive on my social media platform is, how do I find a dentist that thinks like you, practices like you, will talk about the microbiome, will talk about my root canals in the way you are, nutraceuticals, etc. And so I couldn't answer them because there's no certification program. It can be a piecemeal, like you go to get this 1 hour CE here and maybe you read that book, but it's not inclusive. And unfortunately, so many people can call themselves anything, but I do feel we need a certification process and a standardization, and patients need to feel like there's a place to vet their providers, right? And so we are launching that this fall. And so if you are a dentist listening or a hygienist or an auxiliary dental team member, it's a residency level program. So this is not a weekend long course. This is going to take 18 months to 2 years to finish the curriculum, but it will be all inclusive and it covers all specialties. And I mean, it's really amazing. And we've recruited over 40 of the top dentists in the world to lecture. Most of them are in academics and clinical. And we're very excited about it, but it will launch this fall.
Very exciting. Congratulations. And so, in terms of the future, I think we're in such an interesting time. We're going to get to a place soon where, and I've jokingly said this to friends who are around my age, middle age. I've said, we just got to get through the next 10 years. Like, if you're worried about, dementia, Alzheimer's, heart disease, like just avoid cancer. Like, we just got to avoid these things for the next 10 years. And then I think we're going to be good. Don't get hit by a car. Don't get cancer. Don't completely lose your mind. And I think within 10 years, 5 to 10 years, we're going to be good. Like, there's going to be interventions. What's your view with your world as it relates to our mouth?
And it's so much to simplify. It's inflammation. It's inflammation. You want to keep your inflammation as low as possible. And that can be through blood sugar regulation. And it's just all the other things that we know about that I know you talk about on your platform. But I agree with you. So, stay focused. I also don't like people to feel overwhelmed. It can be so much. So, if I shared my oral routine with you and you're like, oh my God, I can't do that. Don't do it. Do what you can do. And so, at the very least, maybe you floss and brush at night. Good. Okay. And then if you have a hard time with some of these things, this is where diet comes in. You need to double down on your diet. I do recommend that, and move your body and hang out with amazing people and have a beautiful community, and don't doom scroll. If someone's yelling at you that your root canal is going to give you breast cancer and you're going to die, you have to not follow that person. They're not serving you toward health. They're not.
Do you think there's anything coming down the pipeline with regards to new technology or a new intervention that could be game changing for oral health?
Yes, I do. AI in dentistry right now is so fascinating. I have a friend that's actually launching a program that is going to be revolutionary, and they are incorporating in functional medicine and functional dentistry into it. It's going to be wonderful. He's going to be working with the Institute for Functional Dentistry. So don't underestimate how helpful AI will be for your providers to help support you, diagnose you, and give you treatment recommendations. But I would say also peptides and stem cells.
For the mouth, for oral health.
Yes, they're being used now in oral health for regenerating tissue. They're being used in root canals. Like, there's an amazing endodontist in LA who's using peptides and stem cell technology in her root canal therapies. And
Do you know which peptides specifically?
I don't.
I feel like I see BPC 157 all over my feed. And it's just like a catch-all, like, oh, whatever it is, it's BPC 157. Throw at it.
I should know this, and I don't. I haven't taken it to memory yet.
Look, it's fascinating. And in terms of AI, I will speak to my doctor. So Frank Lipman, I still see Frank Lipman. And then I will also plug in my lab. So ChatGPT has my genetics, my labs. I will drill down on like, hey, sometimes, so I don't do this all the time, but sometimes if we're going out to dinner, here's the menu. Given my genetics and my goals, what should I eat?
Oh, wow. That's cool. I like that.
And like, what are my, like, why is this marker off? Tell me what's going on with my genetic. Like, what's going on here?
What food would help me boost this deficiency? That's super cool. It's so funny. I was at my functional medicine provider this morning, and we threw in all my labs into to chat, and it was so cool.
It's interesting. You got to know the right prompts. It still makes mistakes and you have to like push it. It is far from perfect. But like, I think if you combine a solid doctor with like the right prompts and the know-how, it's unbelievable.
Exactly. Yeah, and it catches things that the human mind might miss, you know? So the problem is, as a clinician, I'm still a practicing clinician, you're sometimes overwhelmed at your office. Like, you're scattered, maybe you're running behind. That patient was mad or emotional, or, and so you can be not always on your A game, even though it's in there. If you had a moment to sit and breathe and think, but that's not always the case. You're kind of like Johnny on the spot a lot, right? And so that's where these tools can really support a provider, just to make for a better patient experience and outcome.
Agreed. Well, we covered so much. Is there anything we didn't cover that you want to touch on before we wrap?
Just that I love mindbodygreen and everything you guys are doing. So thank you.
Oh, you're very kind. So great to see you. Thank you so much for all of your great work and congrats on the Institute.
Yes. Thanks, Jason.